Had a sports-related injury? All right, who here thinks that their injury could have been prevented easily? All right, quite a few of you. Awesome. Today we're going to be talking about injuries, how we can identify them, how we can treat them, how we can prevent them. Our first one is going to be tendinitis, and this takes place in multiple joints in your body. It can take place in your wrist, in your elbow, and in your shoulder. And it's pretty simple to cure unless you have like Tommy John surgery, like in baseball. But really all you need is ice, rest, and then pain relievers like ibuprofen or something like that. It is an inflammation of the tendon, so what connects your muscle to your bone, and it's caused by overuse, so playing a lot. Most common in pitchers, because you're pitching, over 100 pitches a game. Ways that they can be prevented is proper warm-ups, making sure that you're stretched and warmed before you're ready to go. And also, if you're a pitcher, don't pitch more than 3 days in a row. Our pitchers pitch, I think, 3 days in a week, but that's like Monday, Wednesday, Friday, they're spread out. And then don't play all year long. So give your body some time to rest and heal up before it goes back to playing. Our second one is ACL, PCL, and meniscus tears all take place in your knee. Your meniscus is directly underneath your kneecap. ACL and PCL are on either side. And this is much more severe than other injuries, and unless you have a shallow meniscus tear, which can just take rest to heal, you need surgery and therapy, which takes a lot of time. These ligaments are what hold your knee together, and causes can be short, quick change in direction, landing awkwardly after a jump, or planting and pivoting with your knee extended and planted into the ground. Now, my brother tore all 3 ligaments. He was playing football, sophomore year of college. He jumped up to grab a pass, took a helmet directly to the side of his knee, which made his knee go in and tear all 3 ligaments. Took a long time to heal. He was out the whole next season, the whole next year. Prevention can be strengthening of your muscles, so strengthening of your hamstring, of your quad, and of your calf, and also strengthening of your knee, so like running, bicycling, and doing machines in the weight room. Our last one is concussions. We won't watch the video because I talk too much, so I don't have enough time. But they're also common, and this is a traumatic injury to your brain which alters mental status and also causes other symptoms. Diagnosis is sometimes difficult because it's not always as apparent. So there's a list of symptoms that you can consult. If you have many of them, then you probably have a concussion. Also, a focused neurological exam. I took mine my freshman year of high school, and it's on the computer. And it's just following designs on a computer. It's very simple, takes focus, and that's really it. And if you place lower after a concussion than before, you probably have a concussion. And also long-term / short-term memory tests. So long-term would be like your name, where you're from, what year it is, what's your mom's name, stuff like that. Short-term would be what you had for breakfast that morning, what day of the week it is. So easy stuff like that, which might not always be easy if you have a concussion. And then attentiveness. So if you're talking to someone that you think has a concussion and they can't focus on you and they can't finish their sentences because they're being distracted, they probably have a concussion. And then purgation. After concussion, you have to be out 21 days for relaxing and healing and whatnot. These that are circled, I just had my second concussion 2 weeks ago. And the ones that are circled red are all of the symptoms that I had. The ones that are circled green are the ones that I had most severe. So nausea and headache. I think it's pretty clear why you have a bad headache, because you got hit in the head. How Goshen controls their concussions was very disappointing to me. Really, all I got was a balancing test. They made me put my hands on my hips and close my eyes, go forward, go back, go side to side, and then they told me to rest. What should happen, and I talked to my athletic trainer at my high school, and he also teaches classes and teaches stuff across the country, like holds seminars and whatnot. What should happen is an eye and ear exam, because much like when you're drunk, when you have a concussion, you don't respond as well to certain stimuli. Well, so if I were to shine a flashlight in your eye and your pupils don't dilate at the same rate, it means you're not responding well enough and you probably have a concussion. And then also ear check. If you have blood or other liquids coming out of your ears, you probably got hard enough to have other damaging effects. Your cognitive exam is the one on the computer. I think all athletes should take this freshman year right before they do anything that involves their sport so they can have a baseline for if they do have that happen to them. And then a memory test. And then also just general preventions for injuries is stretching out, make sure that you're ready to go before your practice intensifies. And then rest. We're college athletes. We practice 5 days a week, 2.5 hours a day, and you just need rest, time for yourself to rest and recuperate. And then self-evaluations, because you know yourself better than anyone else. If you think something is wrong, then there probably is something.